Good morning, students. Today I will see about clavicle bone. Okay, clavicle bone. It is a modified long bone. It's only one bone is the horizontally placed bone. Now compared to other bone long bones are the vertically placed bone. The clavicle bone is only the horizontally placed the bone. Okay, it's attached to the appendicular skeleton to axial skeleton. Okay, then it's a modified long bone. It's always called as beauty bone. It's called as beauty bone. Then also called as collar bone. Okay, then it's a modified long bone. It has two ends, middle and lateral ends. The shaft having a shaped structure. Okay, division of the shaft. The shaft is divided into two, lateral 1/3 and medial 2/3. Then peculiarities of the clavicle. What are the peculiarities of the clavicle? What is the peculiarities? It is the special features of the clavicle. Only long bone that lies horizontally. Only long bone that lies horizontally. Second, it is subcutaneous throughout. It is the subcutaneous throughout. Then third, first bone to start ossifying. Body, the human body, the first growth stage, first bones to start ossifying. Then only long bone which ossifies a membrane. Only this clavicle is the long bone which ossifies the membrane. Which ossifies the membrane. Okay. Then for only long bone which has two primary center of the ossification. Then it is occasionally pierced by middle supraclavicular nerve. Then it is generally said to have no medullary cavity, but it's not always true. Then it's a diagrammatical representation of the clavicle fracture. The first 2.1 figure is the right clavicle superior aspect. Superior aspect. That is the acromial end is one side, sternal end is the other side. Then it's the anterior and the posterior. Then the rounded end is the middle 2/3, flat end is the lateral 1/3. Then second figure 2 point is the inferior aspect. That is the inferior aspect you see about trapezoid ridge. Second gonite tubercle. Okay, that's the right side is you see about costoclavicular ligament. Then the lateral one of the clavicle, it is flattened from above downwards. Okay, it has two border, anterior and posterior border. Then two surface, that is a superior and inferior surface. Then borders, anterior border is the concave forward, posterior border is the convex forward. Okay, then surface, the superior surface is the subcutaneous, the inferior surface is the present as an elevation called conide tubercle and trapezoid ridge. Okay. Then the lateral end it bears a facet that articulates with the acromioclavicular scapula to form acromioclavicular joint. Then middle two-third of the clavicle, it is rounded and has a four surfaces: the anterior surface, posterior surface, superior surface, and inferior surface. The anterior surface is the convex forward, posterior surface is smooth. Okay. Then superior surface is the rough; it's a middle part. Then inferior surface is the oval impression at the middle end. Then the medial end, it is a quadrangle and articulate with the clavicular notch of the manubrium to form the sternoclavicular joint. This diagrammatic representation so that the first feature A, diagram A is the mainly about first the blue color line is in the trapezius muscle attachment. Then opposite side parallel to the top is the sternocleidomastoid muscle attachment. Then the lateral in the side lower body is the deltoid muscle parallel to that side mainly for pectoralis major. Okay. Then the B grade diagram. First see about the capsule of the acromioclavicular joint. Okay. Then the capsule, the top of the capsule mainly is about attachment of the deltoid muscle. Okay. Then below the deltoid muscle, so trapezius muscle. Then the center of the clavicle shaft region attached to the subclavius muscle. Then subclavius, the either end, the sternal end mainly serves about the pectoralis major muscle attachment. Then the sternal end is mainly about costoclavicular ligament is present. Then sternal end is sternocleidomastoid muscle also attached. Okay. Then the below the angle, the trapezoid and the conide part of the corticoclavicular ligament also attached. Then muscle attachment. So see about the one by one. The middle two-third of the clavicle It's an anterior surface or give us the origin to pectoralis major. The half of the rough superior surface give origin to clavicle head of the sternocleidomastoid muscle. Then inferior surface has a rough impression in here. It's a middle give attachment to costoclavicular ligament. Then subclavian groove gives injection to the subclavius muscle. Then posterior surface of the close to the middle end gives origin to the sternohyoid muscle. Then lateral one-third of the clavicle. The anterior border gives origin to the deltoid. The posterior border gives origin to the trapezius. Then the conoid tubercle and trapezoid ridge. The conoid tubercle and trapezoid ridge give attachment to the conoid and trapezoid part of the corticoclavicular ligament. Then ossification. The clavicle is the first bone in the body to ossify. It ossifies from the two primary center, one secondary center. Then upper anatomy of the clavicle is mainly for the clavicle may be congenitally absent or imperfectly developed with a disease called cleidocranial dystosis. Cleidocranial dystosis.